Hello everyone, I am Dr. Vinay, consultant pediatrician from Ratan Hospital, Kabra. Today we have Dr. Purnima Ratan, consultant ENT surgeon from Ratan Hospital, Kabra. Today we are going to discuss common ENT related issues in children with Dr. Purnima. Hello Dr. Purnima. So my first question is, what are the common ENT problems in children?
Common ENT problems which we see in ENT OPD is like common cold, ear infections, mid-ear infections precisely, then sinus infections, tonsillar enlargement, tonsillitis, adenoidal enlargement. These may cause snoring, mouth breathing, recurrent upper respiratory tract infections, and many other things are there.
What are the symptoms as a parents they should watch and come to you?
So when parents notice any ear discharge or any pain around the ear, reduced hearing, and in very young infants the child is irritable and crying excessively, then they will have to consult a ENT doctor for that.
So what are the causes for this ear infection? Why do children get ear infection?
Yeah, very commonly it is mid-ear infections, that is AOM or otitis externa. It can be presented in the children. So when there is excessive cry or the child complains of very severe pain and there is sometimes reduced hearing as well. So that time the parents have to approach an ENT doctor at the earliest, because if it is delayed, it might cause hearing reduction in a long run.
So how do we prevent these ear infections in children?
Preventing ear infections, we should avoid giving frequent, in young children, very young children I would say, frequent head baths, putting any Q-tips or earbuds in the ear, and putting oils or any such stuff which are told to them by elders. Practicing such thing is wrong. It is not advised from a medical point of view. You should avoid such stuff.
As a pediatrician, nowadays we see a lot of children coming with snoring problem in the young age from 2 years onwards. So what is your take on that?
Snoring as such is very commonly seen in children. Nowadays we see 2.5, 3 years old children also complaining. Parents are complaining that the child is snoring. It is not a symptom to ignore. It needs medical intervention. Very commonly snoring is seen with children who are having adenoidal hypertrophy, tonsillar infections, tonsillitis also. So when the child is having severe snoring, is having repeated awakenings in the night, it is definitely the patient has to come to a doctor for adenoidal hypertrophy and further evaluation for that.
So for adenoids, do all adenoids need surgical intervention or can be managed with medication, or can adenoids usually subside with the age?
Okay, so there are different grades of adenoidal hypertrophy. Generally, grade 1 and 2 can be taken care with medications, that is local nasal corticosteroid sprays. But if the growth is grade 3 to grade 4, it causes significant nasopharyngeal obstruction. So it is around 70 to 80% of the nasopharynx is blocked. In that kind of patients, you have to go for surgery. And in the long run, if this adenoid is left and it is not operated, it stays there, it doesn't go. The symptoms might come down, but the patient may have sleep apneic symptoms in adulthood.
How safe is this removal of adenoids and tonsils in the children's?
Removal of tonsils and adenoids in children is very safe. It won't have a complication, very minimal number of complications we see, as good as no actually. So child having grade 3 to grade 4 adenoidal hypertrophy requires a surgery, and child having recurrent infections of tonsils causes a child to not eat properly, and that results in patient having not putting on weight in the long run, and there is reduced immunity in the long run. So cutting that vicious circle is very important by removing adenoids and tonsils. That is very safe for the child. It can be done under daycare procedure as well. But for safety purposes, I preferably keep patient for a day hospitalized.
So after adenoid surgery, what is the chances of recurrence of these adenoids or tonsils in children's?
It is near to zero actually. Adenoids and tonsils once removed are not coming back, because tonsil is having a capsule. So we remove the tonsil with the capsule, and tonsils once removed will not cause any recurrent infections in the throat. Adenoidal tissue has some chance of regrowth, but if removed properly till the pharyngobasilar fascia, then it won't come back.
So coming to hearing assessment, nowadays we do a lot of hearing testing for all the children in newborn period. How important is that and why should it be done?
Hearing screening is very important in all children. Hearing screening is done by OAE, that is otoacoustic emission. It has to be done within 3 months of age, and it is very important for all the children, all the newborns, unless whether there is a history or there is no history of hearing loss or anything. Because if the screening is not done, the child might have a reduced hearing, and they might end up having delayed speech and development due to that. It's a simple test which can be done by an audiologist by using a small ear plug in the ear, and it doesn't take it does take only hardly 3 to 5 minutes to be done. So and it's very accessible to everybody as well.
So what are the warning signs that the parents should look into and not ignore in children's in ENT related problems?
So some of the warning signs in ENT would be noisy breathing, repeated awakenings in nights, and difficulty in breathing, patients having recurrent throat pains or hearing reductions, ear discharge, and neck swellings can also be a warning sign.
So finally, what advice would you give to the parents regarding ENT health in children's? So what parents should avoid doing so that they will not be visiting the ENT doctor?
Advice to the parents would be keep the child in good hygiene, maintain good hydration, and one very bad practice what I see in all the parents is they put earbuds or Q-tips into the ears, they put cotton into the ears. Please stop doing that. And whenever you see any symptoms of ear pain or ear discharge, reduced hearing, and recurrent nasal obstruction, recurrent nasal infections, please refer to a doctor at the earliest, because time is very important, and once there is the time lapse is gone, then the child might end up having a permanent hearing loss or having chronic nasal problems as well.
So thank you, Dr. Purnima, for the valuable insight discussing regarding the ENT problems in children's.
Thank you, Dr. Vinay, for the questions and for your time.